Yeah. It's fine.
Off your mic and then put off your video first until you are settled down. Please settle down.
Ma? Hello,
Off
ma.
your mic and your video until you are settled down. Off your mic.
And the video until you are settled down. What's the called video? Oh, yeah. Connectivity telephone change. Abika filme.
Okay, you're all very welcome. To this webinar. It's to commemorate the World Glaucoma Week, to receive every one of us on this webinar. My name is Adepo Jufeyi, professor of ophthalmology, and I'm passionate about eye health education and covering several topics to ensure that people get well educated about causes of blindness, what we can all do to reduce the level of avoidable blindness, and also empower other people that we may know or come in contact with, so that people know what to do at what time, and so that every one of us can have an optimal vision. So once again, you're welcome for as many that are joining us on Zoom, and for some who are joining us on some of our other social media handles, like the Facebook, just go on to Adepoju or Side Ed. On the YouTube, this is with us on the YouTube for Adepoju, and then join the live streaming. Today, we're going to be answering questions on glaucoma after a very short lecture on glaucoma. And to be asking some of the questions will be one of our optometrists, Ashil. So I welcome you, Ashil, as we begin the session. Just lead us through into the question and answer before.
Thank you very much, our dear professor. We thank you for this opportunity to share your knowledge with us and to enlighten us on what glaucoma is. My first question here is, what is glaucoma and how is it? And how important is it?
Actually, what we're saying is, if you have a number of people who are blind, vision less than 360 or less than 660 in their better eye after best correction, if you have 10 of them, glaucoma will be the number one out of all of those 10 that, but blindness from cataract is reversible. So we say it's the leading cause of irreversible blindness. And it is the second cause of blindness generally after cataract. Oftentimes in lay terms, we say glaucoma is a silent thief of sight. And primarily because it's so silent, it doesn't give signs, it doesn't give much symptoms. It just gradually creeps in. Echo. Sorry, we're having some other recording echoing, so that's why I'm slowing down a little bit. Hope the technical team will be able to help us. Okay, thank you. I actually started answering that question until we began to have this replay of some of the recording. I said glaucoma is universal as globally. No. Huh? Have you started? Yeah. Okay. All right. So thank you very much for your patience. Would get back to it. We were having some form of echo that we're trying to work on. Okay, so we're going to just have to start afresh and hope that we don't have this annoying echo, repeating what we've been saying. And so welcome once again. And we're so glad to have everyone gathered together with us. We're going to be looking at glaucoma. It's a disease that affects the eye and cause loss of vision. And we are focusing on glaucoma, particularly because this is what Glaucoma Week. This happens every second week in March. So the whole world is focusing on glaucoma. And with me this morning to help us with the program, she'll be asking some questions, some of the questions people have asked earlier on. And I want to let us know that we also have the opportunity, if you're logged on YouTube, on the comment section, put your questions there. We will take questions from there. If you're on Facebook, we'll also attend to the questions. And of course, for a few people who we have invited to join us on the Zoom, you can put your questions and comment on the chat box. We're going to be looking at glaucoma. It's the silent thief of sight. This program is powered by Sighted, Preserving Vision, Restoring Sight. And to help us through with questions is our optometrist, Dr. Sheung. So you're welcome on board, Dr. Sheung. Can you, yes, you have the floor. Thank you for partnering with us on this program.
Thank you so much, Ma. We so much appreciate this opportunity given to us, dear Professor, to share with us our knowledge on glaucoma. So many people have been curious to know what the disease is and how they can get just prevent the occurrence in their family. So today, the first question here that was sent here is, what is glaucoma and how important it is?
Okay, thank you very much. Glaucoma is a disease that affects the vision. It's primarily a disease that is the leading cause of irreversible blindness, meaning that if you look at all the diseases that can cause blindness, glaucoma is number one that causes blindness, that once blindness sets in, we can't reverse it. There are other causes of blindness that can be reversed, like cataract, but glaucoma is the leading cause of irreversible blindness. Now, if we look at all blindness, either it is reversible or not, glaucoma is still also so important. The second leading cause of blindness. So it means if you have 10 people who are blind from different diseases, cataract will be number one, and glaucoma will be number two. Is that glaucoma is actually a very quiet disease. They're gradually fighting the optic nerve. The optic nerve receive information of what we're seeing and transmit this information to our brain so that the brain can interpret what we're seeing. So this disease affects the optic nerve. And as we all know, the optic nerve is at the back of the eye. So the front of the eye looks very nice and quiet and beautiful. There's no protrusion, there's no redness, there's no watering, there's no deviation. But this disease is quietly fighting the optic nerve at the back of the eye. And that's why we call it the silent thief of sight. So it's a very common disease. I just shared with us how common is it as to causing blindness. But you can know that several other multiple of people have glaucoma as a disease, but yet it has not led to giving blindness. So we'll be talking more about that with time. Thank you very much.
All right, thank you very much, Ma. The second question here is, does glaucoma have different types?
Oh yes, there are different types of glaucoma. And the commonest one is the primary open angle glaucoma. And that's why we're going to be focusing on today, because it's the one that is so typical, that is silent, is quiet, and of course is the commonest of all the different types of glaucoma. This open angle glaucoma, primary open angle glaucoma, will not have symptoms in the early stages. It is gradual, and it begins to take a vision from the periphery, from the surrounding. So if you're looking straight vision looks very good until the very end, but the visual loss is actually coming off from the periphery until maybe in one eye, the vision is getting narrower and narrower and narrower until the central vision is taken off. So it's a component, and that's why we're going to be talking about it. The other kind of glaucoma is the acute angle closure glaucoma. This itself, it's not too common compared to primary open angle glaucoma, but it has a different presentation. The person who has this will have a sudden onset of severe eye ache, severe headache. The ache may be so severe that there will be nausea and vomiting, and it's rapid visual loss, sudden decline in clarity of the vision. And the person may also be seeing rainbows or halos when they're looking through light. The eye will be so markedly red, like what we have in this picture. So that's acute angle closure glaucoma. There are some racial people, some races that are more commoner in them than we have it in our client, but it's something noteworthy. And if somebody develops sudden loss of vision, severe eye ache, very severe headache, there's vomiting or not, and then vision is coming down, the eye is red, please quickly visit an eye hospital, because it may just mean that you have an acute angle closure glaucoma. And once we institute treatment and quickly bring down that pressure, we may be able to recover vision. And then we apply some other form of treatment and some preventive measures, like applying laser to make an eye opening somewhere so that you don't have a repeat of this acute angle closure. But today, like I said, our focus is on open angle glaucoma, and that's why we're going to be focusing on. The other kind of glaucoma, normal tension glaucoma, congenital glaucoma, secondary glaucoma, it's nice to know, but today we're not focusing on them. Thank you.
Okay, thank you very much, Ma. The next question is, can people with glaucoma see clearly? And there's still people with end stage, or probably, I don't know, can they see clearly? Is there any stage that they must see again?
All right, thank you. You know, when glaucoma first starts, the vision remains normal for a couple of years, depending on how high the pressure is. And let me quickly say that the normal intraocular pressure is between 10 and 20 millimeters of mercury. So for some of us, if you want to know how we feel about pressure, what you can understand about pressure of the eye, if you touch your forehead, for instance, and touch the tip of your nose and touch your cheek here, you would see that they have different degree of softness or hardness. This is the more harder part. So if the pressure is this high, it's hard like this, has high pressure, just for you to be able to understand. But we have a way of measuring, and the normal should be between 10 and 20. So when there's high pressure, some people may have high pressure and there is no damage to their optic nerve, there's no vision loss. And some of them may say this is maybe ocular hypertension. But then if it's primary open angle glaucoma, for instance, once pressure is raised for a number of years, it begins to affect the optic nerve. So, but in the first 4, 5 years, 6 years, depending, you have a period where pressure is higher than normal, but yet it's not affecting vision. And this disease is also slowly progressive. So it's not something sudden. So, and I said earlier on, it takes over the peripheral vision at the first instance. So that's the progression. So if you think about how wide we see, when I'm looking straight ahead, all that I'm seeing is my visual field without moving my head. And if it's for one eye, all I am seeing, and I want every one of us to try that, close one eye and see all that you're seeing, that's a visual field on that eye. Close the other eye and see what you're seeing, and that's a visual field on the second eye. So there's a normal visual field which we can measure. What glaucoma does is to begin to take the peripheral vision, like we said, making it narrower, narrower, narrower until something like this. So what it means is that for a number of years, the person may be having damage to the optic nerve with vision loss, but the person is not aware, because if you're not seeing the side, when they move their head and look at the side, they're seeing again. That's why we call it the silent thief of sight. So for initial part, there may be no vision loss. And then when vision loss starts, it begins to take vision from the periphery. By the time someone who has glaucoma have an inclination or an understanding that, my vision is poor, it is already late at this point, because it means most of the peripheral visual field has been taken off and is already affecting the central vision. So you may pass some people along and they hit you by your side and you say, are you not seeing? Maybe they are not having a good peripheral visual field. So just again, try that exercise, cover one eye, see how well you are seeing, or otherwise, and cover the other, see how well you're seeing, and otherwise, do something about it. So from the picture that we're seeing here, someone that have a normal field, see how all the table and all the dressing on the table is being seen maybe by one eye. And then here, there's a moderate visual field loss. And look at this last picture here where there's a severe visual field loss. All the pictures, beautiful images and all of that in all of these places are wiped away, and the person is only seeing this small tubular vision. It can actually get smaller than this until eventually the last part of the central vision is lost. Okay.
Okay, Mal. We'd like you to share with us what are the causes of glaucoma.
Well, like we said, there are primary glaucomas, like the primary open-angle glaucoma, which we're not really certain what exactly is the cause. But what we're clear is the eye, the way it's being made, has a source of fluid being produced, which we call the aqueous humor. And this fluid brings in oxygen, brings in nutrients, brings in so many fantastic things for the health of the eyeball. And then it gets drained through another apparatus. We don't want to be boring with all the big names. Now, if there is an imbalance between how much of this fluid is being produced and how much of it is exiting the eye, it may lead to a buildup of pressure in the eye. So one thing we surely know is that when pressure in the eye is high to a certain level, enough to be able to prevent blood supply to the optic nerve, then we'll say there is a glaucoma. So for primary open angle glaucoma, we say suddenly there is a closure of the drainage pathway, and suddenly the pressure builds up. But we are focusing on the primary open angle glaucoma. This has several risk factors. Initially, we do also know that primary open angle glaucoma can affect all ages, or glaucoma generally, from babies to adults. But primary open angle glaucoma is commoner as people age, 35, 40 years and above. That's where we have it more. So with aging, the risk of having primary open angle glaucoma becomes higher. Now, if at any time the pressure of the eye is measured and is higher above normal, then there is a risk of primary open angle glaucoma. We also do know that glaucoma, primary open angle particularly, is commoner in Africans and Asians. And again, in Africans, you've also noted that the rate of progression is so rapid and the ease of treating is a bit lower. So those are some of the peculiarities with us colored. So people who are over 40 years and above, if you're African origin or Asian, if you're black colored, if there are relatives who have been diagnosed with glaucoma, or relatives that have had blindness and you don't know what is the cause of the blindness, glaucoma tend to have some genetic predisposition. So people who have a family history of glaucoma may likely develop, they have a higher risk of developing glaucoma. We also know that some eye changes, like people who are short-sighted or people who are long-sighted, people who have retinitis pigmentosa or some other eye diseases, people who have had injury to the eye. These are some of the risk factors. But bottom line is, because it can affect anyone of all age, of all race, of all color, then everybody may have that potential risk of having primary open angle glaucoma. That's why this week is being set aside globally on the world thing for all of us to focus on this silent tip of sight and do all that we can to pick it early and prevent it from destroying our vision. Thank you. So,
all right, thank you very much, Ma. The next question here we have is, how do you know someone has glaucoma?
Know if somebody has glaucoma or not, just by cursory looking. Because like I said, the eye looks very normal. There's no redness, no watering, no protrusion. The eye is not sunken. The eye is not deviated. There's no pain for primary open angle glaucoma. So it's hard to know. The only way to know is when we go for regular checkup. When we go to a clinic and our vision is checked, we look at the pressure, we look at the optic nerve, and that's the privilege that we have. The fact that we can look at the nerve that is the primary target of damage from glaucoma. So we do that, and then we may do some other investigations, and then we make up our mind if this person has glaucoma, and if the person is free from glaucoma, and if there's glaucoma, what stage is this glaucoma? So a number of tests that we do to find out if somebody has glaucoma is the visual acuity, where we check how well each eye is seeing. Because glaucoma can usually affect the two eyes, but oftentimes one eye will precede the other. One eye will be more affected first before the other. So it affects both eyes, but one eye precedes the other. And then we check the vision. We check the intraocular pressure, that's the IOP. Then we look at the back of the eye, what we call fundoscopy. Then we can measure the thickness of the cornea. The cornea is that black part of the eye that we're all seeing. So we measure the thickness. We can assess the visual field, like I told us before. We can do some other tests like water drinking tests or facing or OCT. There are several tests that we can do to find out if this person has glaucoma or if the person is free from glaucoma. And if there's glaucoma, at what stage is this glaucoma?
Okay, thank you. Many people are always that would happen. We'd like you to just tell us glaucoma.
What's your question again?
So many people are always curious about what are the options after glaucoma. I'd like you to share with us, can glaucoma be?
Did you say glaucoma be treated? I didn't quite hear that properly.
Yes, can glaucoma be treated, ma'am?
So if I get your question, can glaucoma be treated? Yes, that's a good question. Now, glaucoma, we have to treat. And the major focus of our treatment is to bring down the intraocular pressure. We want the pressure to come down. We want the pressure to be within the limit where damage to the optic nerve will. I'm not sure if I've mentioned it along the line of this lecture, that once glaucoma takes vision, once it damages vision, we cannot reverse the vision loss. At the point where we get the glaucoma is when we begin to treat and want to prevent further visual loss. We want to prevent further visual loss, or we want to slow down the progression of visual loss. So there are several means by which we try to treat glaucoma. And the first option I'll put here is drugs. We have eye drops. We have drugs that people can take and swallow, but majorly we use topical drops. There are different types, different ways they act, different power or ability in which they can bring down the pressure. So your physician or whoever is treating you will tell you if they want you to start on drugs, how many drugs, and how often do they want you to use it, and which one they want you to use in the morning or in the afternoon. There are several medications that are used. Some of them may have little side effects. Don't leave your physician. Don't stay away from them. And in particular, some people, once they have glaucoma and they give them drug, and then, oh, okay, now that means I'm free. No, glaucoma treatment is lifelong. So if you're placed on medication, you need to keep seeing your doctor. They need to be able to tell you if the drugs are working, if the pressures are reduced to the level that they have targeted. And even if the pressure is down, you need to continue to visit or your follow-up and measure your pressure and let your doctor tells you, continue your medication, or we are reducing the medication, or we're increasing it, or we are changing the regimen or timing that you should use your drug. So please, treatment is lifelong. If you're on drugs, don't stop your medication on your own. If you have complaint or side effect, please see your doctor, tell them. Then they will change your drug and work with you until you have a medication that is doing excellently for you as a person and is not causing you much discomfort or side effect. But of course, there are several other ways we treat. We can apply laser, SLT laser, if it's available, or you ask your physician. It's also sometimes used as first line of treatment, or they join it with medication, or you are picking it as a second choice of treatment. Whatever it is that your physician or your ophthalmologist is talking to you about on how best to treat the glaucoma, please, the person has to follow and has to follow very strictly and without default. Some patients with glaucoma have an habit of not using their medication, and when it's like a day or two to visit their doctor, then they will put it. And when the doctor checks, he says, oh, your pressure is normal. Please, let's not do that. Ensure you use your drug as at when due, and when you're going for follow-up, carry your drugs to show which one you are using and how well it's working for you. And ensure that your drug use is all the time. When you leave drug for a week, the pressure goes down, it goes up again. If you're off drug for 2-3 days, the pressure goes up again. And when you start, we do not want these fluctuating, pressure is down, pressure is up. Eventually, it causes further optic nerve damage. I've talked about laser in brief. This is an example of a laser machine for SLT. Surgeries are also done. We call it trabeculectomy, and there are different other types of surgery for glaucoma. If your doctor feels surgery is the best option for you, please, you just need suggestions to have. Sometimes we do a combination of treatment, like I said. Some life changes that you may take on, you may do exercise. We do know that exercises can make pressure go down. Sometimes fasting helps pressure goes down. If someone is obese, this has some other risk factor. You can do your work on your weight, and when the weight comes down, it may also help your pressure. And a number of others, mild. If you're smoking, definitely you have to stay off smoking, you know. Your doctor will guide you on the other different kind of lifestyle changes that can help in the control of your pressure and in the treatment of glaucoma.
All right, thanks you very much, Mal. I think we've had enough and we know little about glaucoma now, and everybody with glaucoma should always have their eyes checked, as said already. And if you're on live treatment, always check your pressure, ensure your IOP is within normal, and always ensure you go for regular checkup. Do not by any means assume because the pressure is down and you think you're fine and you do away with regular checkup. This is very, very important. Thank you so much, Ma. We appreciate once again for those time you share with us and this knowledge you have shared with us. We want to know if there's any final word you have for the entire community to be able to know more about the eye examination, especially those who are already diagnosed with glaucoma or suspect who probably have family history of glaucoma. So any final words for us, for the community now?
Final words before we take on some questions that people have sent ahead, and others are encouraged to also keep to send their questions as required, so that we can take them. For some of the final words that I would like to give to us as we commemorate this World Glaucoma Week is a whole week that has been dedicated because of the importance of glaucoma and because of the havoc that we have seen glaucoma wreak in, among friends, among colleagues, amongst the populace, and we're so committed to seeing it that we change this story round, that people who have glaucoma do not necessarily go on to have blindness from glaucoma, and in particular because the blindness from glaucoma is irreversible. So some key final words that will be of help to us. People often confuse glaucoma as a cause of blindness from cataract. So we have seen a number of patients who will come and say, well, I know my vision wasn't doing well, but some of my friends or colleagues or family members visited an eye hospital and they were told that what is wrong with you is not yet matured. And so I thought I should wait a while. And we keep seeing people coming in late like that. And so please, there are different diseases that will cause blindness. The way they act is different from one another. So your best bet is if you have a complaint with your eye, quickly visit an eye hospital nearest to you so that they can check and let them be the one to tell you if you are waiting for a while or if treatment should have actually started long before then. Don't wait and compare yourself to another person and say, I thought I should also wait. Blindness from cataract is reversible. That from glaucoma is not reversible. And the earlier we catch glaucoma, the cheaper is the treatment, the easier is the treatment. So that popular saying, a stitch in time saves 9, is very, very relevant if it comes to the issue of glaucoma. So we just want to plead with us, don't compare to somebody else, visit the nearest eye hospital. And again, we have said every one of us, either there's complaint in your eye, there's family issue of blindness or not, we are supposed to do annual eye checks. But many people are not doing this. We need to check, are my eyes okay? Is my vision okay? Is the back of my eye okay? Because there are several other silent causes of vision loss. And again, the eye is like a window through which we can see several things happening in the body. That's the privilege that we have. Please make use of this privilege. So go for regular eye checkup, either you have complaints or not, at least once every year. For people who have family history of glaucoma, it is compulsory, it is mandatory, it is non-negotiable. And if you've been diagnosed with glaucoma, please encourage your children, your brothers and sisters to go and check their eye. Using this means, we have been able to early detect people who have glaucoma long before it causes loss of vision, and then they can have good quality of life and they can stay healthy even though they have glaucoma. And they will be managing and treating the glaucoma. As I said, treatment is for life. So please keep your appointment and follow up your schedule. If you're giving once every month, please obey. If you're giving once every 2 months, please do. If it's once every 3 months that you have been asked to come, please don't miss your treatment, your follow-ups. Either you're on drugs or you have had surgery or you have had laser. Regular appointment is not negotiable and you need to keep it. And if you have complaints in between your time of appointment, don't wait and say, no, they asked me to come 3 months' time. That's when I'm going to come. Please visit the eye hospital immediately again and lay your complaint. Now, if you have medications prescribed, use them as at when due. Don't decide to use it when you like or how you like it. There are specific reasons why your physician or doctor will tell you, use it this one in the morning or use this one in the evening and use it at this time different. And if you are on multiple eye medication, maybe 1 or 2, if you put one eye drop, it might be better for you to wait like a minute or 2 and close your eye. You can put a little pressure at the opening here where the fluid is supposed to drain, so that you give that drug the opportunity to flow into your eye and to allow it to do what it is meant to do. Now, if you're on 2 medications and you put one and you put another one almost immediately, you will note that they will just wash each other out and they will not be able to do what is expected of them. Now, for people who are on treatment for glaucoma, because we don't have a definitive treatment, there's nothing that we do and we say, okay, you have been cured, you need to have good understanding. One other common thing we have seen is people say, well, I've been using the drug for so long and it doesn't seem to be doing anything. You're not seeing what it's doing, but we know what the drugs are doing. They're supposed to bring your pressure down and stop further damage. So some of our clients will come and say, hey, I used it for 3-4 months and I saw there was no change. We did not tell you that the use of that drug is going to give you any change in your vision loss, because the vision loss cannot be recovered. All we're doing is to ensure that you don't further lose your vision. So ask your physician questions. Read round on glaucoma, but please just be sure where you are getting your information with. On the social media now, there are several misleading information that is putting people into error. Be mindful where we're getting your information from, but ask your physician questions. If they give you a leaflet to read and things like that, ensure you read and come back and ask questions. Encourage all family members to check their eyes. This is very key. People who are having glaucoma need our support. They need us to encourage them to say, have you visited the clinic? Are you using your drugs? Are you out of your drugs? When is your next appointment? Some of them may need us to take them to the clinic, particularly if the vision loss is already significant. So let's encourage our family members to check their eyes once every year. That's a part that we all have to pay. And then we should all be involved in spreading the message. As many of us that have listened to this message, then you know something about glaucoma. Share it with your family members, share it with your friends, share it with your acquaintances in your places of work, in your places of worship. And you all can also invite eye care personnel to come and give lectures at your mosque or churches, at your social gatherings, at your organizations, and then encourage people to come to check their eyes. Of course, we've talked about exercise and people who are smoking to stop smoking. Glaucoma, you know.
All right, thank you very much, Mal. I have a question here.
Now, we don't want people to keep using unprescribed drugs. One of the risk factors I missed out is, sorry, before you ask your question, one last bit. One of them is steroid. I'm not going to mention any particular name, but don't use any drug just anyhow. It must be drugs that are prescribed, even if they are orthodox drugs. So steroid eye drops or tablets can cause glaucoma. Please don't use any drug anyhow. And even if you are prescribed a drug, use it for the period of time. And if your physician says stop it, please stop it. All right, thank you. We'll take some of your questions now.
All right, thank you. Someone sent this question, but before I read it, please, if you have any other question, please send it before we round up. She said, I think he's talking about those who are already diagnosed of glaucoma. How does their lifestyle change? Is it only what they eat, or what change in their lifestyle? The person is more inquisitive about what is their lifestyle changes. So what are their lifestyle changes? Is there any particular thing that has to change about their normal routine? Do you hear me, Ma? Can you hear me?
You were talking about lifestyle changes for people who have glaucoma. As much as possible, we do not want the glaucoma to affect their quality of life. But some of the lifestyle changes are things like exercise, weight loss if you're on the obese side. If you have hypertension or diabetes, you need to be properly treated. And you must also let your ophthalmologist know if you are being treated for hypertension and what kind of drugs you are using. So those are some of the few changes in the lifestyle that may be required. Of course, follow-up visit is regular. It is once a month or once in 2 months or once in 3 months. So we're going to be requiring from you that period to go. Some people say, oh, they're just wasting time. They take a lot of time. To treat glaucoma can be costly in terms of time and money and resources, but blindness is actually costlier. So we must do everything that we can to ensure that we're not blind from glaucoma. So those are just a few things in terms of course, a good balanced diet, fruits that are rich in antioxidants and vitamin A. Not that they will cure glaucoma, no, but these are things that are good for your usual good eye health. There's a short video we'd like to share before we take on the next question. And I'm going to be giving, okay, you have the hosting right. You can please share the video if you have it. If you have not gotten the video to share, we can pick 1 or 2 more questions while we're trying to share very short video, and then I'll take 1 or more questions, and then we'll round up. Any other question?
Yes, I'm back, Ma. Can you hear me, please?
I can hear you.
All right, thank you very much.
I can hear you, yeah.
All right, the question I have here with me is, how frequently should one visit the clinic once diagnosed of glaucoma?
Question. Now, the treatment of glaucoma is usually so specific to the individual. depending on the stage of the disease. I've told us the late stage disease of glaucoma is more difficult to treat, is more costly, may require more frequent visit compared to early stage. And then depending on how severe the glaucoma is, and of course, depending on other risk factors that are available in this particular patient. So oftentimes we will set a target for ourselves. How much of this pressure do we want to reduce? From what level, and which level are we planning to take it onto? So how frequent each person will visit the hospital will be dependent on some of these various factors. And of course, your proximity to the hospital where you live. So the best bet is to follow the prescription of your ophthalmologist. They are in the best bet after they have seen you. They know the disease, the stage of the disease. They know how well you are responding to treatment. They know how well you are complying with like to see. But averagely once in a month, or once in 2 months, or once in 3 months, it depends. That's the way we do. Of course, if you have just had surgery, you may have more frequent check if your pressure is doing well, there are no complications, if your eye is behaving properly to the surgery, and so you may need more frequent visit. And of course, at the initial diagnosis, because of tests and investigations, and for us to see how well you are responding to the choice of treatment that the doctor have given you, we may need to see you a bit more frequent. And later, when everything is stabilized, and we also have a good understanding that you have full knowledge, or at least fair knowledge of this disease, that may also instruct us on how frequent we like to see you. I hope I've been able to answer.
Oh, yes, ma. I have a question here. I think a patient here is curious about our treatment. So she wrote here that what can be considered as the best form of treatment for glaucoma?
Well, that's a tricky question to ask because almost all the treatment options, drugs, lasers, surgery, and all of that have their strength and have their low side. So to pick what is best will depend on where you are, the disease, the kind of disease you have, the degree of that glaucoma, and of course, the surgeon or the eye doctor that is treating you, what is available in that environment. So if I pick drugs, for instance, we do know that because drugs have to be used almost every day, sometimes 2 or 3 times a day, compliance with some people may be an issue, particularly people who are very busy, they are traveling, sometimes they forget their drug somewhere and they leave the drug at home when they have gone to work. So we know that particularly if the medications have to be multiple medications, compliance or ability to adhere strictly to the treatment plan may be a bit difficult. Now, there's some people where they are living may not have the newer anti-glaucoma medications that are expensive and that are also affordable, or that are, you know, they may not also be available there. So for people also, their earning power, what kind of work do they do? Because medications now are a bit expensive, and it is every month. We need to say, can this person afford this medication monthly, or should we rather do surgery? You know, so there's so many things that will determine what is best for you. So we can't put down something down and say this is the best. In some environments, issue of fake drugs, issue of expired drugs, issue of drugs that have been on the shelf for too long and are not effective, will be there to consider. And sometimes if you are now having to use 2, 3 drugs, we don't want to go above 3 drugs because we know that people will not likely comply with it apart from being very expensive. So if laser is available, we can choose laser. Of course, if it's your pressure responds very well to the laser treatment, the SLT, you may be off drugs. But some people, the pressure may go back up again after some time. So this question is very tricky. For you as a glaucoma person, the best answer would be you discussing with your ophthalmologist. Let them share with you all the options, the prospect, the side effect, the bad side, the good side, and then what is best for you can then be arrived at. I hope I've been able to help with that question.
Yes, ma'am. Thank you very much, ma'am. We have a few more questions. One of them is glaucoma contagious?
Glaucoma what?
Is glaucoma contagious?
I didn't hear that. Oh, okay. Somebody's asking if glaucoma is contagious. It is not contagious. Staying or standing or working or talking or living with someone with glaucoma doesn't mean you will have the glaucoma. It's not a contagious disease in that term. But glaucoma can be inherited. Like we said, if there's a family history of glaucoma, the risk or the chances that members of that family have glaucoma is high. So it's not contagious. Don't be afraid to relate or to talk with people who have glaucoma. Is not contagious in that regard. Somebody, one Dr. Philip asked here, kindly enlighten us on natural treatment or food supplement to cater for glaucoma. Wow. Well, for now, like I said, food nutrients, they are good generally for your eye health. Vitamin A is food that have that has a lot of antioxidants will be necessary or good, but it's not as if they are typically meant to treat glaucoma, if I put it like that. Glaucoma has to do with pressure of the eye being higher above what your nerve can live with. So, but of course, some vitamins will help to improve the nutrients and the health or the vitality of the optic nerve. But they're not like on the eye up there that will say, take this food or take that food and then your glaucoma will be treated. No, or will be reversed. No. Thank you, Dr. Philip, for that question. We're very grateful. I'm not sure if there are other questions here. So that short video, do we have it now? You can actually share with us. You're already the host.
There's one question here, ma'am.
Yeah, we can take the question after the short video.
Okay, ma'am.
Yeah. Thank you. The video can be shared now. I can stop sharing. Okay. I think I've stopped sharing my slide, so please share the video. Okay, can we take that question while that video is loading? Somebody is asking here, I use system, laptop, and phone most often. Can this cause glaucoma? Thank you for the question. Close monitors, display units generally, either they are phones or monitors or laptops or desktops, are gadgets that makes us look at close distance for a reasonable period of time. There are certain things that are very clear to us that they may cause dry eyes or some asthenopia or eye discomfort. They may cause redness. Surely we know all of those. And that's why most systems now expect us to, after you've been working on your system for a while, you should go away somewhere else, do something else, look at far distance, take off some breaks, and before you come back. Because the continual use not only affects posture, some neck pain, some back issues, you know, they can cause dry eye, asthenopia, they can cause some form of short-sightedness, which we call myopia, you know, if you use for prolonged time. And of course, we've said before at the time that prolonged, people who have myopia or people who have hypermetropia may have a higher risk of glaucoma. So maybe if you come look at it in that regard, but definitely we need to do more studies on this because from our own experience, we're actually finding children who are getting more glaucoma at an earlier age and with a very high pressure. And we're wondering if the recent trend of Gen Z, where we're all on system for so long, what is the impact on the drainage of the aqueous humor Is it leading to increased pressure? So we're not certain about this, but everything should be done in moderation. So like I said, most of the newer system now will give you a prompting. If you have walked on for like an hour and a half, it tells you, can you please slow down and then go and do something else before you come back. So let's just do all that in moderation and let's keep checking our pressure, because we also have individual reactions and responses to some of these things. So it may not be so generalized. So before your last question, I hope it's the last question, can we quickly have that short video produced by, okay. So what's the last question while the video is downloading? So are we done with all the questions? Are we done with all the questions so that we can begin to wrap up on this talk? It's a general, general is broad talk on glaucoma. We hope that in the future we can take more time to look at the specifics. For instance, all the different investigations and how is it done. We can also look at all the different treatments, the advantages, disadvantages, and things like that in more details. Yeah.
Can you see my screen?
I'm not seeing your screen yet.
Okay.
But others can let us know if they are seeing it, but I'm not seeing it yet. So are you able to share your screen now?
I think I'm having difficulty sharing my screen.
Now you are the host, can you share? You are now the host, so you should be able to share. So while we're waiting for that, we're rounding up this segment of today's program. We want to encourage us to please check on our social media handle. There are several other films, short videos on glaucoma and some other eye disorders, just basic health information that can give us empowerment so that we're all, empowered to know what to do and at what time to ensure that we have good vision at all times. Okay, so can we have voice? There's no volume. Can you put volume? The video looks nice, but we are not hearing your voice. We are not hearing the voice from the video. All right, thank you very much. We saw the video, but the volume was not good enough. Okay, so on the anchor, thank you very much. I think we should wrap it up. It's supposed to last for 45 minutes, and we've done that. Thank you, everybody, for attending. We are very grateful for your time, and we do hope that if you have questions and comments, you continue to send to us. We'll be glad to respond to them appropriately. So once again, thank you very much. It's all about preserving our vision and restoring sight, and we look forward to having you at another time, God's willing. So do have a pleasant day, and if you have not done so, go visit an eye hospital and check your eye. It's very important. Do not allow the World Glaucoma Week to pass without you and your family members and your relations, friends, and colleagues. Check their eyes. At least let's log on at every World Glaucoma Week and take that opportunity. Check your pressure. What's the pressure of your eye? You need to know. All right, thank you. One last word from Dr. Shem, optometrist. Any last word? Thank you for your time.
Really appreciate the knowledge you shared with us, and we are most grateful. We are very grateful. Let me just say it that way, and I'm very sure everyone is grateful for this information. I received a comment that this is very educative, and this is very good. We also look forward to receiving more of these programs. Thank you very much, Ma. And I think that's all.
Okay, thank you, everyone. All right, bye-bye. Thank you, and do have a pleasant day.
Yes. Oh, God. This is not easy, man. Okay, sit down.